The Knowledgeable Provider podcast is intended primarily to entertain, also to inform, but it is not a substitute for actual medical training and should not be used by anyone to diagnose or treat any medical condition in themselves or others. If you need medical advice, please make an appointment to see your own knowledgeable medical provider. The opinions expressed by me and anyone else who happens to appear on the podcast are solely those of the people expressing them and are not necessarily representative of any other entities. Other than the lunches at the office, I do not receive any sort of compensation from pharmaceutical or medical device companies, and I have no other relevant financial disclosures. Look, this is all for fun, okay? Don't sue me. All right, on with the show. Hey there, welcome back to Knowledgeable Provider. I'm your host, Jody Marks. I think politics are on a lot of people's minds lately. I'm recording this on Friday, November 8th, 3 days after the U.S. presidential election, and it's a pretty big deal. The episodes of this podcast really are always just about whatever's on my mind, and it's hard to think about much of anything else right now. Obviously, this is not a political podcast, and I tend to keep my politics to myself when I'm dealing with patients. But if you've been listening and paying attention to the podcast, I'm sure you figured out that I'm a pretty liberal guy. And the election going the way it did was pretty shocking. I'm still trying to process where we are and where we're going and what this means and all the things that I'm sure a lot of you are feeling. I'd like to say that politics has no connection to medicine, but of course that's really not true. Obviously, the practice of medicine is governed by laws which are made by lawmakers, aka politicians. And of course, several medical issues played a big role in this particular election, right? Just off the top of my head, you have abortion, gender-affirming care for trans folks, particularly minors, health insurance with the Affordable Care Act, and just about everything we do or don't do is regulated somehow by the state, from our licensing to the procedures we're allowed to do, to the medicines we're allowed to prescribe, especially for mid-levels, nurse practitioners and PAs in Alabama. It's pretty tightly regulated. I don't know if physicians feel the same way. Doctors can pretty much do what they want. But of course, even they have to practice within the law. Everyone knows of cases of doctors getting in trouble and getting their license pulled and going to jail for stepping outside the law. You even see doctors who want to work in politics directly. Over in the Shoals area, Dr. Tim Melson and Dr. Larry Stutz are both Alabama state senators, have been doing that for a long time. Here in the Huntsville area, we have Dr. David Cole, who was going to be an Alabama state representative from our district, but he got in trouble for being a little bit fraudulent, kind of a George Santos light situation. I think he voted in the wrong place. He did something illegal knowingly and ended up resigning his seat before he really ever got started. Dr. Robert Bentley is a dermatologist. He was governor of Alabama back in the early 2010s. And then on the national level, too, some physicians seem to want to be involved in all that. Dr. Ben Carson, he's speaking in Montgomery at a controlled substances summit early next year. I'm actually going to go see him and hear what he has to say. Dr. Oz, Mehmet Oz, was running for office in this past cycle. Of course, you have the United States Surgeon General, it's a political position. More and more, it seems like the president's personal physicians get to play somewhat of a political role when they come out and go, nope, they're fine, against all visible evidence to the contrary. You have your state medical officers that are in charge of the Department of Public Health at the state level. So there's a lot of intertwining there. And if you look specifically at an issue like abortion, obviously the political situation has made a huge impact on that area of medicine. No matter which side of that you fall on, the fact is it's way harder for people to get abortions now if they want them. Here in our state, Alabama, it's almost completely illegal. And the way I read the law, I could actually probably get in trouble for even talking to a patient about where to go to get an abortion. And the outcome of Roe versus Wade in the first place came from a push from liberal politicians and then ended up being taken away by conservative politicians. In our state, it's completely illegal to provide hormone therapy to transgender minors. And no matter which sides of these issues you fall on, I bet a lot of us agree that we would like the government to stay out of medical decision-making as much as possible. I think every medical decision should be between the provider and the patient, and the political and religious beliefs of random lawmakers and strangers should not have any bearing on that. But that's not the world we live in. People's political choices, the people we elect to govern, really do have a big impact on the practice of medicine. So I feel like we can't just ignore it. I would say for the most part, the people I have worked with in medicine are not especially politically active. I feel safe saying that most of us just want to go to work and do our jobs and be left alone like anyone else. But I think it's important to at least pay attention I listen to a lot of news and political podcasts and try to keep up and understand what's going on and make informed decisions and vote in every election. I think all of us ought to at least do that. And then just on a personal level of talking to patients day in and day out, like I said earlier, I try to keep politics mostly out of those discussions, but things do come up and we end up talking about these issues from time to time in various contexts. I'm in a situation where the people that I'm taking care of, my patients, and I'm going to say most of the coworkers that I have ever been around, are probably not on the same page as I am about political things. I work in a small town in Alabama that's surrounded by even smaller towns, very rural areas, and everybody's conservative, everybody's religious, everybody's Republican. I would estimate that easily 90% of our patients are white, conservative, religious people. And me being a white, pretty straight presenting male, a lot of people just tend to assume that I would hold the same views that they do. So most of the political conversations that happen in my office are the patient saying a bunch of stuff that I don't agree with and me trying to look neutral and nod my head and smile and make it through that as quickly as I possibly can and move on, because I'm not going to argue with anybody in almost any context, but especially not in the context where I'm supposed to be the medical professional taking care of you. I'm not going to get into a debate about politics. And at the end of the day, I want you to be happy and keep coming back. So I'm definitely not going to reveal myself to be a bleeding heart liberal, but maybe some people would enjoy that. Maybe some people would enjoy the back and forth and sparring and arguing about things. I don't know how everybody else conducts themselves in these situations. And maybe I'm not giving some of my patients enough credit. Maybe they wouldn't get mad and storm out if I told them how I really feel about whatever I'm talking about. But there's so many different personalities and so many different people you have to take care of. My strategy is always just to err on the side of being polite and non-offensive, because it's pretty easy to stick your foot in your mouth. I was talking with one of my patients the other day, and I asked a very medical question. It was just something like, how's your anxiety level, I believe. And she launched off into this whole story about how her church was becoming more tolerant of LGBT folks, and she just couldn't stand that and just didn't want to be sitting there with those people around her, and they're going to have to find a new church, and she's just so upset about it. Obviously not knowing that I'm sitting there, someone who's married to another man. And the whole time I'm listening to her just thinking like, I wonder what expression's on my face right now. I'm trying to just kind of smile and be neutral. I don't know if I kept the nurse face going at that point, but it's interesting. Even though every patient that walks into the office walks past a picture of me and my husband hanging on the wall, but we know patients don't read any signs. So I guess they don't pay attention to that either. I don't know. But one thing that definitely happens a lot is the patients will make some comment to the effect of, I just don't like where this country's going. And that I can agree with. I say, I know what you mean, or yeah, I know, it's crazy. When I know that we're coming from completely different sides. We're both saying that for totally different reasons. But you can get into a tricky area there. It can be a minefield. And then the flip side of that is when I do have a patient come in who shares more of my political beliefs, who's more liberal. Again, I don't generally start conversations about this stuff, but they will bring it up. And then if I know I'm talking to someone who's more sympathetic to my point of view, I will be a little more open about how I feel about certain things or agreeing with things that they're saying and actually meaning it. But yeah, it's hard to know where the line is when you're having a discussion with somebody like that. And it's interesting to think about how your political views or religious views as a medical provider are influencing the care that you're giving to people. Fortunately, the situation that I practice in, I don't really ever run into situations where something I have to do or choose not to do for a patient comes into conflict with my worldview. I guess the most common example I can think of would be contraception, birth control. I know that's a big deal if you work in a Catholic hospital, or if you yourself were Catholic. I don't know how that would influence how you counsel a patient or what you'd be comfortable prescribing a patient. I bet it does influence more the conversations that different providers are comfortable having with patients. I went to a doctor at one point when I was in my 20s who never once brought up anything sexual. Never took a history, never asked me if there was anything I wanted to talk about, never asked me if I had any concerns. And at that point in my life, I did need to be talking about that. I did have concerns. I needed to be tested regularly for STIs. And I was doing that, but on my own at a different clinic, because she just never seemed to want to talk about it. And I was never comfortable bringing it up with her. And I don't know if that was a religious thing or just a general politeness or squeamishness, or I don't know what the situation was there. But that was a big reason why I changed doctors to somebody that I was more comfortable talking about all that with. And I guess thinking back to my training, other than when I was with a gynecologist, I never really heard people discuss that all that much with patients. And so that's one thing that I really make an effort to do. I pretty much have a way to broach the subject and ask a question to about every age group and every type of person that I'm seeing, because I just think that's important. I don't necessarily want to talk about that with everybody, but it's part of your health. It's part of life. And if you have any problems, I feel like I'm the medical person. I should be there to answer questions, and you should be comfortable talking to me. And that's how I feel like it should be. When we're acting as medical professionals, we should be acting only as medical professionals, not as Democrats or Republicans or liberals or conservatives or Christians or Muslims or Buddhists or Jewish people or atheists or whatever. I think we should adhere to professional standards of care and leave our personal beliefs out of it. Because at the end of the day, we're supposed to be doing what's best for our patients and their lives and their beliefs. And again, in my situation, I don't really have a lot of potential conflicts there. It would be more pertinent for somebody who might actually be called on to perform an abortion or a DNC. I can only imagine how it must be for those providers who get caught between what the patient wants and what they feel is right and what the law says and wherever they happen to be. We've definitely heard stories of women who have died since all these state abortion bans have gone into effect because they needed care, but the doctors or hospitals or whoever were afraid to provide that care because of fear of getting in trouble with the law. Gosh, what a tough decision that must be, right? Do you step out on a limb and do what you think is right for the patient at the expense of your own license and your own livelihood? I don't know what I would do in that situation. I've definitely done things that I wasn't quite comfortable with, even though I felt like that was the best thing for the patient. And I've probably declined to do things that maybe I could have gotten away with and been okay, but maybe not. Gray areas. And each one of those decisions just has to be made individually. But yeah, I don't know what I would do in that situation of, do we do this life-saving procedure that we believe is indicated, even though we could go to jail for it? Or do we not do the procedure and risk the patient dying because we were scared? Man, I feel bad for anybody who's put in that position. And I feel really bad for the patients who get stuck in that position as well. I only remember having one discussion about abortion with a patient ever. And this was after the Dobbs decision happened. I remember thinking it was pretty remarkable even that the patient trusted me enough to talk about it. Because at that point, she had no way of knowing how I was going to respond or what crazy situation I might have put her in for broaching the subject. So it'll be really interesting to see how the second Trump administration affects healthcare. I have the impression that the Republicans have their eye on getting rid of the Affordable Care Act, which would be a pretty big change. There's also been talk of less funding for Medicare, and those kind of things have huge impacts on the healthcare system, of course. They're talking about Robert F. Kennedy Jr. getting to pick who's in charge of the Department of Health and Human Services and the FDA. Of course, FDA actually falls under Health and Human Services, as does the NIH, the CDC, CMS, AHRQ, Agency for Healthcare Research and Quality. So if some nut job is in charge of all those departments, who knows what's going to happen with our guidelines and our vaccines and the care that we're allowed to provide and the approvals for things that might get changed and monkeyed with. It could really be a nightmare. So it's kind of a scary time, both personally and professionally. I guess every election brings some uncertainty about how things are going to change, but this feels like a watershed moment, a turning point when we're really going to see a big cultural shift in the United States. So I guess we'll just have to see how it goes, like everybody else. I don't know if I've provided any useful information in this episode of the podcast, but I felt like I had to talk about it and just get it off my mind so I could move on to something else. I did resist the urge to put out an episode right before the election with all my helpful political views. I'm sure it would have changed the outcome if my 30 listeners had heard my opinions about things. Missed opportunity. Sorry, Kamala. Failed to do my part. So I guess that's really all I got. If you want to share any concerns or if you have any questions for me, feel free to reach out. The next episode I'm working on is a great interview with one of my patients who went through knee replacement surgery, and it's been an absolute disaster. And so she was willing to come and talk to me about everything she's been through. I think it's going to be really interesting. The editing's taking a long time, but I think it'll be worth it once I get done. So there's that to look forward to from Knowledgeable Provider. I hope everyone's well. I hope you're taking care of yourself. And if your team won this time, hey, congratulations. Yesterday, one of the patients who's always very consistent about asking me about me after we get done talking about him, which is sweet. He'll say, how's your family? How's everybody doing? And then yesterday, as I'm walking out of the room, he goes, I hope the election went your way. It definitely went my way. And I just didn't know how to reply. I was like, and walked out the door. I didn't have the right words to say it. I just sort of bolted. So I guess he got the message. But anyway, we'll keep muddling through. We'll figure it out. It'll be okay. Thanks for listening. I'll talk to you next time. All right, that does it for this episode of Knowledgeable Provider. I'm your host, Jody Marks. Thank you so much for listening. Please be sure to like, subscribe, or follow on your preferred listening platform. Give us a nice 5-star rating and leave a nice review. If you'd like to help support the show, you can do that at patreon.com/knowledgeableprovider. And as always, stay safe, take care of yourself, and take care of your patients in that order.